So today we're taking a deep dive into FTM surgery in India.
Okay.
And what's really interesting is they're specifically targeting international patients, people coming from, the US, Australia, Europe, that kind of thing.
Huh. That's interesting. It kind of makes you wonder what's driving that, this kind of global demand for FTM surgery in India specifically.
Yeah. And that's what we're going to try to unpack a bit today. The website is called Best in India, and they promote a bunch of different medical procedures, but FTM surgery is definitely one of their main focuses. They boast about like these super high success rates, which of course, always got to take that with a grain of salt. But before we jump into all that, maybe we can just break down the actual procedures involved in FTM surgery, at least as this website describes it.
Yeah, sounds like a good place to start. Getting a handle on the medical stuff can definitely help frame the rest of the conversation.
For sure. So they've got it broken down into three main steps. The first one is breast removal, what they call what's medically referred to as a mastectomy. And they're very, they emphasize that this not only creates a more quote unquote masculine appearance, but also helps patients avoid potential complications that can come up with, chest binding and things like that.
Right, right. Because chest binding can be really hard on the body, physically demanding. And it does come with like its own set of health risks if you're doing it a lot. Interesting that they highlight that as like a reason to consider surgery.
Yeah, it's like they're trying to appeal to like a patient's desire for both like physical and emotional well-being. Okay, so then step two, this is where things get a bit more intense. This is where they either perform a vaginectomy, so removal of the vagina, or a hysterectomy, so removal of the uterus. And the website does acknowledge that a vaginectomy is like generally considered a higher risk procedure.
Yeah, that makes sense. I mean, anytime you're dealing with more extensive surgery, there are always going to be more risks.
Right,
Yeah.
exactly. But they're very, very quick to reassure potential patients that, their surgeons are like, top notch, highly specialized, and maintain a low complication rate. So,
It's interesting, the language they use there, like they really emphasize specialization and low complication rates.
yeah.
Seems like it's tailored to like address those anxieties someone might have about, traveling abroad for such a major surgery.
Totally. It's like they're trying to build that trust and confidence from the get-go. All right, now buckle up, because step three is where it gets really, really intricate. Phalloplasty, the creation of a penis. And this isn't just like a one and done kind of thing. It's actually a multi-stage process. This website lists out 7 stages.
7 stages.
I
Wow.
know, right?
That is seriously involved. I mean, it really speaks to the complexity of what they're trying to achieve surgically.
It's incredible. And it's not just about like, creating the penis itself. They also talk about lengthening the urethra so someone can urinate standing up, and creating the tip of the penis. They even talk about fashioning the scrotum. Like they go into detail about using skin grafts from other parts of the body for this.
Wow. The level of detail there it's remarkable. You're right. It really highlights how intricate phalloplasty is. Like, just think about the process of creating a functional urethra. That alone, that takes incredible, meticulous surgical skill to make sure it heals properly and functions the way it's supposed to.
Right. And the fact that they're taking skin grafts from other areas of the body, I mean, that's major surgery. Makes you really think about the recovery process and what kind of like support system is in place for patients after something like that.
Yeah. Yeah, that's a lot to process. And it really makes those claims about high success rates all the more interesting. You know what I mean? Like, how do you even begin to define success in a procedure as complex and multifaceted as this? What are all the different factors that contribute to a patient feeling like, okay, this surgery was a success?
That's such a good question. And honestly, the website kind of glosses over those specifics. It's all about, the technical aspects, the stages, the supposed high success rates. But what about like the human element, What about the individual's experience and their own like personal definition of success?
It's a critical point, and it leads to another, I think, really crucial question, which is, are we looking at these procedures solely from like a medical perspective, or do we need to broaden our lens a bit to encompass, the psychological, social, even cultural dimensions of this experience?
It's like there's this whole other layer here to unpack beyond just the surgical procedures themselves.
Absolutely.
And that's something we're going to explore further, I think, as we go on.
It's so true. It's like we can't forget that we're talking about, procedures that are just, they're so deeply personal and so intertwined with someone's sense of self, their identity. Speaking of which, I was looking at this website and they use that phrase, completely transformed body quite a bit. And it just makes me wonder about the kind of, I don't know, expectations that that sets up.
Oh, totally. You totally hit the nail on the head there. It's like they're implying that surgery can somehow like erase a person's entire history, all their lived experiences as someone who was assigned female at birth. And it also kind of begs the question, like, who gets to define what a completely transformed body even looks like?
Exactly. Like the language they use suggests a very specific ideal, right? Like it's aligning with those more traditional, like binary notions of gender. It makes you think about the pressure that could put on individuals, like this idea that to be fully accepted as male, you need to, conform to this particular, I don't know, physical standard.
And it's not even just about the physical stuff either, right? This idea of a completely transformed body. It can have like, really profound psychological implications too. It makes you think about like what are the emotional and mental health considerations for someone who is undergoing such, significant physical changes, right? Like are those things being addressed?
Yeah, for sure. And
Yeah.
that highlights, I think, like the need for these really comprehensive support systems to be in place.
Yeah.
Like these procedures shouldn't just be about the surgical aspect. They need to be approached in this holistic way that addresses, the emotional and the psychological well-being of the individual, like throughout this entire journey.
Absolutely. We can't forget that like undergoing these procedures is really just one part of a much larger personal journey for a lot of trans individuals. And it kind of brings us back to this this interesting detail we touched upon earlier, which is this website's like clear targeting of international patients, specifically those from the US, Australia, Europe, like what's up with that? Like what's driving this like global influx of patients seeking FTM surgery in India specifically?
Right. I mean, it's complex. There's a lot of layers to it. I
Yeah.
mean, cost is definitely a significant factor for a lot of people, right? Like medical tourism often comes down to people looking for, more affordable healthcare options, right?
Yeah.
Procedures that might be, way too expensive in their home country, especially when you think about, insurance coverage and all that, could be significantly cheaper, like way cheaper in India.
Right. So it's about like accessibility, at least from like a purely financial perspective, right?
Yeah.
But I imagine there's got to be more to it than just cost, right?
Oh, for sure. Yeah. We also have to think about the social and legal landscapes,
Hmm.
surrounding like transgender identities and rights. I mean, the fact is acceptance and like legal recognition of transgender individuals, it varies like wildly from country to country.
So it's like someone might be like way more inclined to travel to a place like India for surgery if they're facing like a ton of discrimination or prejudice or even just a lack of access to like, quality care in their home country.
It's a sad reality,
Yeah.
but for many transgender individuals, yeah, like seeking out these procedures, it becomes as much about, navigating a world that's like not always welcoming or supportive as it is about like, making these deeply personal decisions about their own bodies. It's a lot.
It's such a powerful reminder that these decisions don't happen in a vacuum, right? Like
Hmm.
it's all intricately woven into this fabric of, social and cultural and economic and even like, political factors. It's a lot.
Absolutely. And it really underscores, I think, the importance of trying to understand the broader context. When we're discussing something as personal and as complex as gender affirming surgery, it's not just about the medical procedures themselves. It's about recognizing like the individual's experience and those societal forces that inevitably like shape those experiences.
Yeah, it's like we're only seeing this tiny little snapshot of a much bigger like story here, right?
Like,
This website, it's like it offers us this glimpse into this world, the world of FTM surgery in India,
yeah,
but it's really only scratching the surface,
yeah, that's
of
right.
what's really going on, both for like, the individuals who are like actually seeking out these procedures
Right.
and for the societies that are like, grappling with these huge issues of like gender identity and healthcare access and all of that.
Yeah,
Yeah.
and it's like we're seeing the tip of the iceberg, right? The
Right.
the website showing us all this, technical stuff, the marketing,
Right.
all the supposed benefits.
Yeah.
But underneath all of that, like there's this whole intricate network
Right.
of human experiences and societal norms and like ethical dilemmas
Good
that
guy.
that we can't ignore.
And that kind of brings us to, I think, like a really, really like crucial question here, which is
Yeah.
what are the ethical implications of this like growing global market for, gender affirming care?
Right.
We've talked about, the potential cost savings and the
Yes.
possibility of like, escaping certain societal constraints by seeking out these procedures abroad. But what about like the other side of that coin?
Yeah, I mean that's the question, right? Like we can't shy away from it. When we're dealing with healthcare that's so closely connected to a person's, identity and their well-being, we really have to be careful. Like we have to make sure that we're not accidentally like perpetuating inequalities or overlooking potential risks.
Right.
Like, for example, how do we make sure that there's like equitable access to this kind of care,
Right.
regardless of, someone's nationality or how much money they have? Like, are we basically creating a system where only the people who can afford to travel
Right.
are the ones who can actually get the care that they need?
Exactly. And what about, like the potential vulnerabilities of patients who are like traveling to, countries they're not familiar with
Totally.
for like these really complex medical procedures?
Yeah, are these folks getting like, the proper like pre-op education
Right.
and like adequate post-op care?
Yeah.
Like what kind of support systems are there to to help them through what is, let's be real, a really major life transition?
For sure.
And are we even thinking about the cultural differences
Right.
that might like actually impact a patient's experience, like, not just during the procedure, but in the weeks and months after?
It's so easy to get like, so caught up in the like the medical stuff, the surgical techniques, the before and after pictures. But
Mhm.
but the truth is this is about so much more than just, like changing your body,
Of
right?
course.
It's about respecting, the individual's journey and
Yes.
making sure that they're safe and that they're cared for.
Absolutely.
And honestly, like it's about creating a society that's both informed and empathetic.
I
Yeah.
think that's so well said. And as we kind of like, move forward as a society and as
Yeah.
individuals, I think it's just so important that we keep, asking these tough questions and
Yeah.
and challenging our assumptions,
Yeah.
and advocating for a healthcare system that really prioritizes both, physical and mental well-being,
Yeah.
no matter where someone chooses to get their care.
It's so true. And I think this entire deep dive has really been about that, about like peeling back the layers a bit,
Mhm.
going beyond just like that surface level information and
Yeah.
and encouraging you, the listener, to really like sit with this and contemplate, all these complex things that we've been talking about,
Right.
the interplay between personal choice and societal pressures and ethical considerations.
That's a lot.
It's a lot. It's a lot to unpack, but we hope, even just having this conversation has given you some things to think about as you continue to learn about these
You
issues.
too.